Another story making news today, Professor Rees, is that South Africa was meant to make a payment in addition to that made by the Solidarity Fund to COVAX. Concerns that a deadline has been missed. Your thoughts on that? I don't know how these deadlines work. It's presumably not like securing a ticket on an airline, but on the other hand, a deadline, I would have thought, does have some binding significance.
Well, yes. I would say sort of yes and no.
Okay.
Yes, because I think that what the COVAX facility is trying to do as quickly as possible is to pin down countries to commit to this facility, because the more countries commit, the stronger is the bargaining power of this facility to not only procure vaccines, but procure them at very competitive prices, just because of the size of volume that will be requested. But at the same time, particularly for self-financing countries, there really is an understanding that this can be complicated, that there are rules, there are budgets that have already been fully allocated for next year, that people are trying to find their ways around not only the rules of a country,
yes,
but also in very difficult economic times. Where are you going to find that money? So that, I think, is understood, and I think that there are real attempts to try and work out with countries how to facilitate it. What I've heard from the Department of Health, who are negotiating this, there has been a contract initially signed with COVAX between the South African Department of Health and COVAX. What I've heard is that if we're on track, that in the second quarter of next year, we should be able to procure some vaccines through this facility.
News.
Experts.
Analysis.
Where things stand.
What you need to know. Drive home with John Perlman
On 702.